Osteopathy is a sort of system of diagnosing and treating damaged parts of the musculoskeletal system, so ligaments or muscles or bony problems, joint problems. What tends to happen is that we get areas that move more than other areas, so you get sort of restricted joints, and then that puts strain on those joints that are already doing too much. So what osteopathy can do is just to keep everything functioning as well as possible, which will then hopefully prevent, those areas which may get strained, not to. A patient would come in and I'd take a fairly detailed case history, both of what their presenting problem is and also any sort of relevant medical history. And then I would ask them to undress down to their underwear and examine them and come up hopefully with a diagnosis. And from there I treat them. The thing I see most of is low back pain, but I mean anything. Neck problems, neck restriction in movement if they can't turn their head, knee problems, ankle problems, elbow problems, shoulder problems. But often people have had problems for quite a long time, or certainly problems that have been recurring. Generally then it's sort of more of a management thing. There are people who are constantly aggravating what they're doing, either by sitting all the time or driving or what they're doing work-wise, in which case you might need to see them on an ongoing basis. The manipulation itself doesn't hurt, although again, if somebody is in pain when they make any kind of movement, then a bit of manipulation may hurt very sort of briefly. But most people go out immediately feeling better. Massage is very useful often as a follow-up after osteopathy, and that can often be a way of people, maintaining sort of the good health, is to come to me for a couple of sessions and then maybe go on and have massage.